In this episode of Breaking News with Bay, I want to talk about the differences between a mini tummy tuck and a tummy tuck. To start off, most of you, unfortunately, are not a candidate for a mini tummy tuck. Sorry to say it. But a mini tummy tuck is really more for like a marathon runner where they just have a little bit of excess skin, maybe after a pregnancy, like they have a C-section scar and just a little roll of skin underneath that or above that. But there's not really this bulge, the abdominal bulge, the thing that's called a rectus diastasis when the abdominal wall is stretched out. Not a lot of love handles, not a lot of fat, mostly kind of a ripped stomach with just a little bit of skin at the bottom. That's a mini tummy tuck candidate because what you would do is just make the incision below that excess skin, including the C-section scar, and get rid of that all at the same time. Go underneath, remove that layer of skin that they can't get rid of with exercise. But you don't do anything with the abdomen because assuming the six-pack muscles are already together, there's no rectus diastasis, and that they don't really need any liposuction. So that's a candidate for a mini tummy tuck. A full tummy tuck is when you have that excess skin, but you also have excess fat, and you also have the bulge in the abdomen, the rectus diastasis, and in that operation, you have a much longer incision to get rid of the excess skin and also to get access to the abdominal wall because you elevate that skin up to the breastbone here, and then you tighten up the abdominal wall in the middle of the rectus diastasis. You help bring those six-pack muscles together to flatten out the tummy. You might even put a row of stitches along the oblique muscle to help further tighten that up, basically to give the patient an internal corset like women used to wear, or like Kim Kardashian wears for the Met Gala. But anyway, that tightens up the muscles, the abdominal wall up on the inside. You remove the excess skin, do liposuction, maybe even put in a couple drains. That's a full tummy tuck. You can see how that is significantly different than just a mini tummy tuck. And most patients, because they've had kids, because not everybody is in the greatest of shape, most patients are really more of a candidate for a full tummy tuck versus a mini tummy tuck. And then things like an extended tummy tuck, that's just a longer incision because the excess skin goes out further out to the sides. And then there's a circumferential tummy tuck where you have excess skin along the back, and that can also be called a body lift by some doctors, but you can see how they're just kind of gradually getting more invasive and bigger based on the amount of skin you have. So the doctors aren't doing this operation, one operation over another, just to be mean. It's based on how much skin you have. So a little bit of skin, no stretched out abdominal wall, minimal fat, mini tummy tuck. More excess fat, stretched out abdominal wall, full tummy tuck, then an extended tummy tuck, then a body lift or a circumferential tummy tuck. So hopefully that was helpful and you'll know which one you fit, what category you fit. And you can check pricing on all of these on our website at realdrbae.com/pricing. That's RealDrbae.com/pricing.